Hi guys, we're going to talk about just foundational basic concepts of mental health nursing. And I want you to think about adjectives that would describe mental health, not mental illness, but adjectives that would describe mental health. So when we think about those adjectives, we think about things like these people have the ability to realize one's own abilities. They are able to cope with normal stressors of life. They have the ability to productively work, and they can contribute to their community. So we're going to differentiate what does mental health look like versus what does mental illness look like. And primarily we're going to look at mental health with this chapter, but we're going to try to compare it to mental illnesses so that you can understand the concept once we start actually diving in to each of the mental illnesses that we're going to talk about this semester. So let's get started here. So mental health is the emotional and psychological well-being of an individual who has the capacity to interact with others, deal with ordinary stress, and perceive one's surrounding realistically. Mental health is foundational for emotions and emotional well-being, thinking and learning, meaning there's rational thinking going on, communication that is appropriate, resilience and self-esteem. So how would you define resilience? When I think about resilience, I think about the words like bouncing back, recovering from, difficult or challenging or adverse circumstances. It's really the ability to adapt, to withstand, and to successfully navigate through stressors, setbacks, or disruptions. You have coping, you can continue to function or grow in adversity. Those are really great words that will define resilience. Also think about relationships and just daily functioning. So what does mental illness refer to? We've talked about mental health. Now let's switch gears and think about mental illness. It refers to psychiatric disorders that have a definable diagnosis that can result in emotions such as like depression. It can result in changes in thinking such as either Alzheimer's, maybe ADHD. It can result in changes in behavior, such as schizophrenia. You could also maybe put ADHD in that category as well. Patients in some cases display a combination of all of these alterations. Mental illness is also associated with distress and problems in daily functioning, meaning social and family relationships may be more challenged. They may not be able to productively go to work or school. So what are some of the associated factors that increase the risk of mental illness? And when I think about some of those factors, I think about trauma or traumatic life experiences. I think about substance abuse, loneliness or isolation, and I think we can think back to like COVID, right? Factors that associated our risk with mental illness was just being lonely and isolated when we were in quarantine. You can also think about biological or genetic factors that can definitely come into play. So the mental health continuum is a range of responses and individual displays regarding life events. The end vary between positive and negative responses, and they're often viewed as mental health versus mental illness. So you can see the well-being side versus the mental illness side. And this can really be viewed like as a thermometer. So for some, mental illness can be mild, in which it may not interfere with daily living, but it does consume some of that individual and it debilitates them to enough that they may need some hospitalization. The continuum is a wellness to illness model, which is very dynamic. It's not static, right? It's very fluid. So well-being is on the health end of the continuum. And in this area, individuals experience an absence of mental illness. As we move towards the end of the continuum, that is the opposite of wellness, and that is a disability. And at this point, the individual demonstrates manifestations of mental illness and really has a lot of difficulty functioning. So you can see in between the well-being and the mental illness, we have several terminology here. So I want to talk about each of those terms. So let's say we are excelling. Often that is viewed as mental wellness, right? The absence of mental illness, no symptoms, the patient's usually going to describe themselves as being well. Now, what if they say, I am thriving, right? We're moving up that thermometer. And although they may be experiencing stress, that stress is not causing significant daily impairment. The client can still resolve those stressors. As we continue to surviving, we're not really in a state of distress, but it is a state in which problems need to have some actions. So you may hear the client say, I'm feeling a little on edge. So this is where I would stand, right? If I'm surviving, I'm on the edge of either excelling or going into crisis, right? Struggling may be a significant struggle. That may include worrying, misery in their daily living. They may feel a sense of worthlessness. And then crisis is that final severe clinical manifestations of mental illness. It's now disrupting their living and their functioning. Individual attributes refer to those that are inborn and learned characteristics that make us who we are. Right? We all have different attributes that we have learned. And even if we've learned to deal with stressors, it makes us who we are. I don't deal with stress the way you may deal with stress. And that's what makes me who I am and makes you who you are. We all manage our thoughts, our feelings, and our everyday pressures of life in very unique ways. And when we talk about resilience, we talk about those that have endured tragedy, loss, trauma, and even some severe stress. So the ability and capacity to secure resources needed to support well-being is resilience. Resilience does not mean that you aren't affected by the stressor. It just means that you have the capability to regulate your emotions and not fall victim to negative thoughts. It's characterized by the ability to secure those needed resources and the capacity for regulating our own emotion and overcoming negative self-defeating thoughts. And resilience is really essential to recovery. If we aren't resilient, if our patients aren't resilient, they're going to just live in that trauma. And so in order for them to recover, we've got to help them build those characteristics of resilience. So let's talk a little bit about perception of mental health and mental illness. What is perception? How would you define perception? Perception are unique to individuals, and it's really that ability to be aware of something through your senses. Perception should be compared to other individuals. There is a distinct difference between mental illness and physical illness. Mental meaning brain and the higher thought process. Physical meaning the connections, the functions, the spinal innervations. The biggest perception of mental illness is that psychiatric disorders imply that it is all in the head, which leads to the stigma that they are flawed and socially shunned, disgraced, or shamed. There are no specific tests to diagnose psychiatric disorders. There's no CT, there's no MRI, compared to epilepsy disorder where you can see overactivity or excitability on a brain scan leading you to that diagnosis. So how do bias and stigma affect mental health? Almost half of the individuals who have a mental health disorder do not receive any care for their manifestations. And why is that? Often there can be a delay in seeking help or treatment because of fear of being judged or treated differently because of the negative stigma of mental illness. When we define stigma, it is a negative attitude or discredit against an individual or an unidentifiable group in which the individual or group is labeled as being different. There are 3 types of stigma that have been identified. Public stigma, which occurs when there is a negative attitude towards those that have mental illness, which can be expressed in discriminatory attitudes or actions. There is self-stigma, which occurs when an individual adopts that negative view or internalized shame about themselves or their condition. And then institutional stigma occurs when a governmental policies or organizational limits the opportunities for those with mental illness. And that can be both intentional or unintentional. When we think about bias, this includes stereotyping, prejudice, or even discrimination against a group of people that in comparison to another group, which is unfair and often resulting in unfair or an unequitable treatment of that individual or that group. So stereotypes is a generalization about specific group of people. Prejudice is a preconceived belief about an individual not based on facts. And discrimination is an unjust treatment of an individual or group of people based on a category that they have perceived to be in. So different types of biases can include implicit and explicit. So implicit is when the bias occurs outside of one's conscious. Explicit occurs intentionally, displaying those behaviors of discrimination towards someone. So definitely biases and stigma can have an effect on mental health. So the diathesis-stress model is a significant model which explains how mental illness develops and then how is it exacerbated. So when we think about diatheses, that's that genetic or biological predisposition, right? It's describing that individual's genetic or biological predisposition for developing a mental illness or an illness. This is the individual's vulnerability towards developing this mental illness. So then stress can include a change in person's environment, physical or psychological, which may precipitate manifestations of a mental illness. So if we have the genetic or biological predisposition, and then we add the stress of the within the environment or trauma, then what is the impact? And the impact is that they're going to have an increased risk for developing a mental health disorder, because it's been linked to the genetic or biological predisposition plus an environmental stress or trauma. Those with a higher diatheses may require less stress triggers to develop a disorder. Those with lower diatheses may be more resilient and require higher stress to experience a mental disorder. So this model is not saying everyone who experiences stress will develop a disorder. It is stating that the combination presents the likelihood. So social determinants of mental health is based upon understanding how conditions in which people live, work, play, and age impact their mental health. This really results in psychological distress that can result from multiple factors, such as discrimination, prejudice, and exposure to violence experienced by individuals based upon their age, their gender, their sexual orientation, their race, their ethnicity. Those all can play a role in long-term mental health. So when we think about environmental factors, we need to think about, where do these people live? Where do they work? Where do they play? Are they in a rural setting or an urban setting? Some of the individual attributes or behaviors we could consider are biological and psychological, as well as family history. So those genetics. And then social or economic circumstances, right? We need to consider their socioeconomic status. Have they had any discrimination, prejudice, or exposure to violence? And you can see all of those determinants can create mental health determinants. So some examples of factors that impact our mental health and well-being, we can think about life course. So if our patients have been exposed to physical, environmental, or socioeconomic events at critical stages throughout their life, this can have an impact on their mental health, not only for that individual, but also for subsequent generations, which can lead to mental health disparities. Household factors include income, access to resources like food and water, parental, mental and physical health, social support, and maternal care. Unemployment conditions in the household can definitely influence the risk of mental illness. Community factors can influence mental health because of those built and natural environments. What is the neighborhood security? What is the degree in which the individual can participate in community events? If they are in a community with high crime, high violence, then they may not be able to contribute, right? If they don't have things like green space or safe areas to walk and play, then they're not going to be connected socially within that community. Local services are mental health and wellness services that include schools, social services, health-related services, family services, age-related services, and access to clean air and water. And then community and global factors are those human rights, access to healthcare, housing needs, policies for education access, governance, and inequality. So when we think about what influences does nursing have in addressing these factors? So I'd like for you to pause the video and just think of some examples that maybe you've already experienced on how nursing can address some of these factors, whether it be life course, household, community, local services, or community and global factors. All right, the DSM-5-TR is the Diagnostic and Statistical Manual of Mental Disorders. It's the 5th edition, and there is a text revision. And this is the principal diagnostic tool for defining and diagnosing mental conditions. The purpose of this tool is to define and diagnose mental health conditions. It uses common diagnostic language and the classification of mental health disorders. So you will, if you ever are in a mental health facility, you'll utilize this manual quite frequently. Nurses that work with mental health clients in any setting are responsible for ensuring they practice in a manner that is both legal and ethical for their clients. So these should all look familiar to you. You probably had that maybe in ethics class or principles class, but some of the ethical principles that we can think about are beneficence, right? That's the obligation that healthcare providers must act in a manner of doing good for a client and preventing harm. Autonomy is that clients should have the ability to make rational decisions related to their care. Non-maleficence is the concept of doing no harm to the client or avoiding causing pain or suffering. Justice is the fair and equal care and treatment of all patients, regardless of background or culture. Confidentiality is ensuring the confidentiality and privacy of the client's information. Culturally sensitive nursing care is foundational for providing patient-centered care, and it involves the delivery of respectful and responsive care that is based upon the needs, the preferences, and the values of the client. This ensures autonomy for the client, it promotes equity in the delivery of care, and it guides clinical treatment and nursing interventions based upon the client's rather than the nurse's needs and preferences. Cultural humility is the practice of trying to appreciate and respect another individual's culture and the role it plays in the individual's life and health practices. So in order to promote that client-nurse relationship, through a display of sensitivity and respect for the client's diversity. It's best to follow a combination of all three aspects: care that is patient-centered, cultural competence, and cultural humility. So my example for culturally sensitive nursing care is many years ago, I took care of a teenager, was a football player. They came in dehydrated, very dehydrated, and gave them some IV fluids. And I sat in there and I talked to them like, what is your, like, how did you get to this point, right? So he started talking to me about his culture. And he was in the middle of Ramadan. So if you're not familiar with Ramadan, when the sun is up, there's no eating, it's fasting, right? It's fasting and nothing is taken by mouth. When the sun goes down, then that's when they eat, that's when they drink. Well, that's also when this kiddo probably slept. So it was a vicious circle for him, right? He goes to football practice for a couple of hours a day. He gets dehydrated. He goes home. He waits till the sun goes down. He drinks as much as he can before he's probably exhausted and goes to sleep. And then he wakes up and then he can't eat or drink anything. He has football practice. He goes home, right? It's this circle that he's going into. So we really had to come up with a plan that was culturally respectful for him, where he wasn't ending up in the urgent care every other day for IV fluids. So we did come up with a plan that was very sensitive. It was very centered, client-centered, and respectful for his needs based off of his culture. So do we know all of the cultures that are out there? We don't. But take the time to sit down with your patient. What are their preferences? What are their values? What are their needs? And that's going to make you a very cultural humility nurse. So what is psychiatric mental health nursing? This employs purposeful use of self, promotion of mental health through assessment, diagnosis, and treatment of behavioral concerns, mental disorders, and comorbid conditions. These nurses work with patients throughout the lifespan, so pediatrics, adolescents, adult, and even elderly. They assist with crisis or those with acute life problems, as well as those with chronic mental illnesses. So if you're interested in mental health nursing, definitely a shortage out there, and I would very much encourage you to kind of jump in with 2 feet and go for it. There are a couple of different levels of psychiatric nursing. That basic level is where you can educate, coordinate care, do some teaching, some maintenance, collaborative therapy. As you move into more of an advanced role, that's when medication prescriptions, treatment, psychotherapy, consultations, you typically have to have a master's or a doctorate in psychiatric nursing for that advanced practice. But we all can practice on a basic level. And that concludes foundational basic mental health. If you have any questions, you can shoot me an email or we can chat about it in class. Thanks, guys.